All right. So welcome everyone to today's webinar with the New England PTTC. I'm Kristen with the PTTC. I'll be supporting today's webinar. I have a couple of notes for us before we get started. As I just mentioned, today's webinar is hosted through the New England PTTC, the New England Prevention Technology Transfer Center. PTTC program is funded by SAMHSA at the Department of Health and Human Services. The contents of the New England PTTC products are those of the authors and do not necessarily represent the official views of, nor an endorsement by SAMHSA and HHS or the US government. The goal of the New England PTTC and the broader PTTC network is to improve implementation and delivery of effective substance misuse prevention interventions. We do this by providing training and technical assistance services to the substance misuse prevention field that are tailored to meet the needs of the recipients and the prevention field. We encourage prevention that's based in prevention science and the use of evidence-based and promising practices. If you haven't visited the PTTC network website before, I know many of you have come to us from that way, but I would encourage you to check out pttcnetwork.org. If you're joining us from New England, we have many resources, and if you're joining us from another region, you'll be able to connect with your regional PTTC center that way, and they may have some region-specific resources available to you in addition to welcoming you in to join our New England programming as well. A couple of brief logistics. We are in a Zoom meeting format here, which makes it wonderful to see some folks' faces. We do have a fairly large group, so I'll ask that everybody do their best to stay muted throughout the webinar to reduce background noise and interruptions. We do have the chat going where folks are introducing themselves now, but you can also use that to drop questions in. We'll try to save a couple minutes for Q&A towards the end of the presentation. There will be a brief evaluation at the end of today's webinar that I'll drop in the chat and email for folks, and I will be emailing certificates directly to participants within a week or two of the close of today's webinar. And I think that's it from me. So I will briefly introduce our speaker for today. Dr. White is the Board of Trustees Distinguished Professor and Chair of the Department of Pharmacy Practice at the University of Connecticut School of Pharmacy. His research interests are in the areas of comparative effectiveness and preventing adverse events from drugs, devices, dietary supplements, and illicit substances. And many other credentials, which I will not read all of them here to you today, but we're very happy to have Dr. White here today to share with us a little bit about nitrous oxide and what might be useful for us to know. So with that, I will hand it over to you, Dr. White. Thank you.
Thank you very much. And thank you all for taking your lunch hour and spending it here. If you want to know some more information about me, they'll have the slides, and you're free to use any of the slides that you would like to. But here you can find a little more about me. What I really hope by the end of this presentation that you're going to be able to do is describe the legitimate uses of nitrous oxide, to describe the legal loophole that is permitting recreational sales that's ended up driving up the increased prevalence of use in the United States, to describe the intended effects that the users are seeking and the major adverse events of people who are using or abusing nitrous oxide, describe the mechanisms of harm, and then describe the cornerstones of detection and treatment based on those mechanisms of harm, and finally to describe the potential public health measures that could be used to reduce exposure. So who uses nitrous oxide? Well, you can see that they're used by a whole host of people in the food and beverage industry: baristas, bartenders, pastry chefs, and savory chefs, to use nitrous oxide to whip, froth, and foam, right? So we've all seen that little canister that they have, and then they shake it up, and they can turn cream into whipped cream, or mashed potatoes into lighter and fluffier mashed potatoes, right? A lot of people are using nitrous oxide for that. Auto mechanics are using nitrous oxide in high performance car engines to enhance engine power and efficiency. And that means that when things happen to that, right, that they need the ability to use nitrous oxide during the repair of those systems. And finally, a whole host of industrial workers that are assembling things like semiconductors are using nitrous oxide within that production. Nitrous oxide is commonly used by dentists for painful gum procedures, and especially in pediatric patients. So here you can see this nasal mask is being used, and it's providing both nitrous oxide and oxygen to the patient, right? And that's really, really important, because people that are using it recreationally are just using the nitrous oxide by itself. It's also sometimes used by anesthesiologists for short-term surgical procedures, but in general, it's not being used for its own pharmacologic effects, but rather because it enhances the effect of other inhaled anesthetics that they're using for that procedure. So the rationale for use for medical or dental purposes is that nitrous oxide is the least potent inhaled anesthetic, and that it's very safe for short-term use. It induces anesthesia, it dulls pain, and then it elevates the mood. It's administered by inhalation, it's absorbed through the lungs, and then it's eliminated by the lungs or by the kidneys. Effects occur really, really quickly, within 1 minute. And then the elimination half-life is about 5 minutes. So that means that after 5 half-lives, or about a half hour, about 95% of the nitrous oxide that was inhaled has been eliminated from the body in people with normal kidney function and normal lung function. So how is nitrous oxide causing anesthesia, analgesia, and anxiolytic effects? Well, if you look up above for the sedation, hypnosis, and dissociation effects, you can see that it is inhibiting the NMDA channel, and that is hyperpolarizing neurons so that they no longer work normally for a period of time. And then you can see that it causes the release of these endogenous opioids, enkephalins and dynorphins, that are stimulating mu and kappa opioid receptors, causing both the sedation, hypnosis, and dissociation effects, and also the analgesic and especially the euphoric effects. And then you can see that it is stimulating the GABA A, and that the GABA A stimulation is working with an anxiolytic effect, in part along with some of the effects that it's having on the opioid receptor. So who is using nitrous oxide recreationally? Well, back in the old days, the people that were using it recreationally were dentists and anesthesiologists, nurses, dental hygienists, because the tanks were in the office, and it was something where they had the availability. The ability to take those large tanks and be able to move them into other places were more difficult. Now there's people that are also using it, like baristas and bartenders, chefs and restaurant personnel, automotive workers, industrial workers, because the tanks and canisters have been moved into those non-medical settings with a broader constituency. So what about teens and young adults? This is the next group to have abused nitrous oxide. And what's happening is that you can see that there are smaller sized cartridges, which is what you see in the bottom right there. And then there's canisters, which are larger than that, but are still relatively small, that are being sold in convenience stores, gas stations, smoke shops, and over the internet. And that creates a new opportunity for young people to be able to acquire one of these substances. So why is nitrous oxide being abused? Well, most people are abusing it for its euphoric or mood elevating effects and for a temporary alleviation of anxiety. It's available, like I said, in gas stations, convenience stores, and smoke shops. And so a child could go into a gas station on the way to school or on the way home. They could pay with cash. And in many states, there's no age restrictions to purchase. On those shelves, they come in fun colors with scents and flavors. And the nature of nitrous oxide abuse means that it's easier to hide from parents, from your boss, from your parole officer, because the effects come on very quickly and they go away within several minutes. There's no lingering cannabis smell, there's no tobacco smell. It's not something that's part of a standard work screen or school drug screen. And especially when you're talking about cartridges, but also to some extent with canisters, they're tiny and they're very easy to be able to hide from people like parents or teachers or school administrators. So, how many people have used nitrous oxide in the United States? It's estimated that about 13 million people had used nitrous oxide uh, as a lifetime incidence when it was looked at in 2023. About 2 million people have used it in this past year, right? So new users actively using this year. American Poison Control Centers found a 58% increase in reports of intentional exposure to nitrous oxide in the United States between 2023 and 2024, right? So utilization is certainly increasing. And then look over here on the right as to what population within the United States is most likely to use it. And so one of the things that becomes really clear is that the people who are 26 and older are less likely to have used within the past year than people who were 12 years of age or younger. And then the 12 to 17 group and the 18 to 25 group are the most common groups, but really it's the 12 to 17-year-olds that are driving this utilization, right? So they can't purchase cigarettes, they can't purchase vaping products, they can't purchase alcohol. And so this is something that they can purchase without proof of, being over a certain age. And it's in a place that's convenient for them where they could purchase it without their parents knowing. So United States Poison Control Center data from the U.S. National Poison Data System for people that are 13 years or older seeking care after nitrous oxide use were evaluated. And what you see is that across all of the years from 2003 up to 2024, that 1,751 people met the inclusion criteria. But look how the annual cases have changed from 28 cases in 2003 to 401 cases in 2024. Now, most of the utilizers have been male. Most of the exposures, though, look at this, 85% are occurring in private residences, right? So a child buys this at a gas station without anyone knowing. They have a couple friends over. They're in the person's room or they're down in the basement. And as long as you don't come down and check in that few-minute time period when the people are actively experiencing the effects of nitrous oxide, you're probably going to miss it. Most cases occurred of poison control center utilization in those 20 to 29 years of age. But the important thing to remember is when did they start using? Probably before they were 20 years of age, but their utilization increased over the course of time, and they end up having enough utilization either over a shorter period of time with massive utilization or with very chronic utilization to get longer clinically recognizable adverse effects that end up bringing them into the healthcare system. So here we're showing death rates, and the death rates are not high overall, right? So even in 2023, it's somewhere about 0.06, maybe 0.062 or so. But look how it's increased over the course of time per 100,000 people in the population. So down from 0.01 deaths per 100,000 people, and now up over 0.06 deaths. So a six-fold increase in those deaths. So you might be asking, how can somebody sell nitrous oxide to preteens and teens and get away with it? Federal law does say that it's illegal to sell nitrous oxide for recreational purposes according to federal law, but they don't have any stipulation as to how or what responsibilities people would have to know what the purpose was when people are buying those products. The companies that are selling them are pretending that they're selling it for frothing and whipping, and then they provide fake recipes on the box or the website. Many states have no age restrictions to purchase nitrous oxide products. And so down below, I give you, a few things showing that, even though their box may say it's for food preparation only, their intent seems to be different, right? So what company would buy small canisters of nitrous oxide to sell at a gas station for somebody who's going to be using it for their cappuccino machine? Why are nitrous oxide companies buying booth space at these champs conferences or these trade shows that are going on all around the country? Here they have an exhibitor theater with vendors selling all types of quasi-legal and illegal products to people in gas stations, convenience stores, and smoke shops. Why are they selling it and linking themselves to that form of utilization? They're starting to scent and flavor the air, which isn't needed for the frothing or whipping, but would make it more attractive and seem less dangerous to teens and preteens. And they're selling it in brightly colored canisters with mascots and or fun sounding names, right? So in the old days, one of the big things that had prevented broad scale utilization was that it came in a large tank, and that you had to put down a deposit for the tank, and then you had to return the tank in order to get back your deposit. Right now, it's a lot of the products, whether they come in small tanks or canisters, uh, you know, based on that form, they're all disposable products. In June of 2025, the FDA came out and warned consumers of these different products, and they identified many products that they believe are being used primarily for the purposes of people getting those euphoric or dissociative type effects. Here were four other on the right that they didn't come up with that I was able to find. And then the common terms that people would use when they're talking about this out on the street would be hippie crack, whippets, and laughing gas. So here are some of the products. And so what I wanted to show all the way over here on the left is that this Hot Whip product comes in bomb pop flavor, right? Bomb pop flavor. So not something that people would be using for their cappuccinos. This next one, they have a Skittles Blast flavor, and you can see they changed the spelling of Skittles so they weren't violating the trademark of Skittles, but you can see it is rainbow flavored, looks like Skittles. And then the last one, for people that liked Breaking Bad, which was specifically about illicit drug use, here we have Baking Bad, and you can see that across all the products, these things can come in different flavors such as mango smoothie, vanilla cupcake, strawberry stardust, and watermelon eclipse, right? But down on that package or somewhere on the package, what they are saying is that it's for food purposes only. So what are some of the acute harms? So people that use it this one time and they're harmed based on this one single use, not based on their chronic utilization of the product. Well, one is that people may experience falls after losing consciousness or developing severe dizziness. And when nitrous oxide was first discovered and created, there were people that came around the United States in the 1800s where they had a traveling show and they would bring people up on stage and they would give them laughing gas or nitrous oxide for the amusement of the people that came out. Well, in Hartford, Connecticut, since this is a New England thing, I'll give you a little bit of trivia. There was one person that came up on stage, used nitrous oxide, fell off the stage, and had hurt their leg. Right, they could see visible injuries to the person's leg. So a dentist who was there at the time came up and asked the person whether they were feeling pain, and the person was saying, "No, I didn't feel a lot of pain." And so that dentist was the first person to do a tooth extraction using nitrous oxide. The person then closed up their shop and had decided they were going to be a traveling salesman selling nitrous oxide and chloroform to doctors and dentists. However, became addicted to chloroform shortly thereafter, ended up getting arrested, and ended up killing themselves in jail. So it was actually a number of years later, a few decades later, before people stumbled back upon nitrous oxide as something that they could use in a dental practice. The gas inside these cartridges or these canisters or these tanks are under a lot of pressure. And when you release the gas from those high pressure containment parts, they can end up lowering the temperature at the point that you're doing the release. So that means that people could have frostbite on their lips or their skin from this released gas. The tanks have a higher risk than the cartridges or than the canisters, and the canisters have a higher risk than the little cartridges. That's why people are mostly taking the nitrous oxide and putting it in a balloon before they ingest it. There's also death from asphyxiation, where people are passing out while they're wearing a mask, or they're actually taking a bag and putting the bag over their head and releasing the gas in the mask in order to be able to get a more prolonged effect from the nitrous oxide. However, if you pass out and you have a plastic bag over your head filled with nitrous oxide and not with oxygen, you could develop hypoxia, which could lead to asphyxiation. If you pass out when you're wearing a mask only giving you nitrous oxide, again, you could die from that. Something that's going around on TikTok and is being propagated into places like Instagram are showing these different reels of people that are going into cars and then they're releasing nitrous oxide into the car for a more prolonged nitrous oxide effect. Where again, if you pass out there, if you're in the car and you're not getting good oxygenation, you could die or you could cause brain damage or heart damage from that. And that has been shown with both MRI testing and radionuclide testing in a few cases. A final acute harm is pneumothorax. Here, the partial pressure of nitrous oxide is higher than that of nitrogen. So if you're inhaling it into your lungs too quickly, you can overexpand the lung, and then you could end up causing a tear that would depressurize that lung and cause that lung to collapse. So people that are using larger balloons rather than regular sized balloons, people that are actively trying to inhale really, really quickly have a greater risk of pneumothorax. So now we're going to shift gears and talk about the implications of chronically using nitrous oxide, right? So people that just use nitrous oxide, if they avoid those acute events and they do it on one Saturday and then they don't try it again for 4 months, are not going to be experiencing these types of signs and symptoms. But the people that are using it every day, or people that are using higher doses but using it at more regular intervals, are going to be at risk of having these types of adverse effects. The first one is tingling and numbness in their hands and feet. And so it's a little more severe in the feet than the hands, at least initially. And that occurs in 80% of the people that came in complaining of chronic utilization adverse events. Unsteady gait. So this isn't somebody that feels unsteady because they just use nitrous oxide. They have a hard time being able to walk with steadiness all the time now because of the chronic use of nitrous oxide. Limb weakness in 43%. You could see that it is causing a macrocytic anemia where each individual red blood cell is larger than normal, but the hemoglobin hematocrit is lower than normal. And you can see that that's happening in around 50% to 56% of people. People that are experiencing falls or muscle weakness from things like numbness in their feet and their unsteady gait and their limb weakness are experiencing falls about 24% of the time. About 14% of the time, people have detected vitamin B12 deficiency. And just to ruin the punchline that we'll see soon, even people that do not have vitamin B12 deficiency have vitamin B12 that is being inactivated by the nitrous oxide, causing these chronic problems. So ataxia, right, where people are feeling, very unsteady and uncoordinated, cognitive decline, and even paralysis is occurring somewhere in that 7 to 10% range. And then some other symptoms like bladder dysfunction or fecal incontinence, loss of libido, and erectile dysfunction, similar to what people may be experiencing with multiple sclerosis. And then some of the other symptoms up above also could be seen with multiple sclerosis, like the paresthesia and the unsteady gait and the weakness, also occurring rarely, but can occur with higher ingestion doses and more chronic utilization of the products. And then we have this other one, thromboembolism. So people are starting to get blood clots. Even these young, healthy people are coming in with blood clots, rarely, around 3% of the time. So this is something that looks kind of like a mishmash of different things. There are some things that are happening in the hematologic system with the suppressed hemoglobin and also the thromboembolism. There are things that are happening in the central nervous system, right? And so how are all of these things coming together, and what can explain those issues? Well, we'll talk about that in just a minute. The FDA just went through, and these are the acute and chronic adverse effects that they were most concerned about from utilization. And then you can, on the other slide, you can see their percentages. Well, here's the mechanisms of neurological damage, anemia, and thrombosis. And you can see that the culprit of it all is what's happening here to vitamin B12, or what they're calling cobalamin. And what happens is that this vitamin B12 has a cobalt molecule, which is really helping to drive the effects that are being caused by vitamin B12. And when it becomes oxidized by the nitrous oxide, it ends up moving out of its normal placement, and it no longer is causing dysfunctional enzymes. On the one hand, the methionine synthase, and on the other, the methyl malonyl CoA mutase enzymes to work properly. So if you go up above where it says methionine synthase, you can see that homocysteine is supposed to be turned into methionine by this enzyme. And that's going to regulate normal concentrations of both homocysteine and methionine. If that's not working and you don't have enough methionine, it's going to cause the myelin sheaths to not be replaced as they become damaged on nerves, leading to demyelination of those nerves. And in a demyelinated nerve, it takes a lot longer for electrical impulses to go up to the brain and to come back from the brain down to the nerves. You could see that It also causes T2 hypersensitivity within cervical cord degeneration that you could see on an MRI. If you're not getting rid of the homocysteine by turning it into methionine, you can increase the concentrations of the homocysteine, which is a marker for your risk of thrombosis, and you could increase your risk for blood clots in the process and inflammation in that process as well. It can also cause some apoptosis of some of cells, including nerve cells. You can see that over there on the right side, it also takes methyl tetrahydrofolate and turns it into another active form of folic acid called tetrahydrofolate. Down below, you can see that if you don't have methylmalonyl-CoA mutase in order to be able to do what it does, that you'll accumulate methylmalonate. And methylmalonate can also do some bad things to some of the nerves. And so what you're seeing is a deficiency in methionine and an excess in both homocysteine and methylmalonate, or also called MMA. If you don't have enough vitamin B12 directly, the vitamin B12 is needed in order to be able to make red blood cells. So you could end up with megaloblastic anemia. So how would you detect it? Well, you would detect it not by looking at vitamin B12, although you can, and as we saw, some people did have lower concentrations, but even people with normal concentrations could have issues because the vitamin B12 that they do have is not functional. But you would still get elevations in both homocysteine and MMA when you did those tests. Now, those are not standard tests and they take longer to be able to come back, and you shouldn't prevent the onset of providing treatment if you highly suspect that there was chronic nitrous oxide use, because the treatments are generally innocuous. So how should we be detecting and treating patients that have nitrous oxide use? Well, there are 4 different treatment protocols that I found. Here are the references for all of them. So for a lot of the slides that come after, they came from one of these 4 different types of slides. And what you'll see is that a lot of them are either from the UK, from Australia, from Canada. And that's because nitrous oxide abuse ended up started coming into much greater prominence in the UK than it did in the United States. So after tobacco and alcohol and cannabis, nitrous oxide is actually one of their most commonly abused substances, falling right after cannabis utilization in the UK. So, what are some treatment guidances for chronic nitrous oxide abuse? Right, these were the key points that I came away after reading those 4 things. Chronic high-level recreational nitrous oxide exposure impedes vitamin B12 function, leading to neurological dysfunction and rarely myelosuppression. Right, so myelosuppression would go to those myelin sheaths. Patients often present with symptoms and signs that are consistent with something that clinicians know as subacute combined degeneration of the spinal cord. And this usually happens in people in third world countries who have severe malnutrition, but can also happen with significant malnutrition in some people in the West, like people who may have anorexia nervosa. Measured B12 may be normal or low, and it doesn't reflect the functional vitamin B12 concentration. And then discontinuation of nitrous oxide and administration of intramuscular vitamin B12 and oral methionine are going to be the mainstays of management. So how would you assess people in relation to their chronic use? Well, if somebody comes in with an acute toxicity, something like short-lived confusion or a hallucination or a fall or pneumothorax, ask them whether or not they had a precipitant like nitrous oxide. And if they did, then you can go down that uh, testing and, if needed, treatment path. People with a history of recreational misuse of nitrous oxide, where they're using higher doses or they have chronic use, are more likely to get those chronic adverse effects that we just talked about. The regular daily misuse or misuse less frequently, but they're using higher than 100 cartridges or balloons per session, are also reported in cases where there's clinical evidence of neurological dysfunction. When the symptoms start to occur, if you continue with your use, they're going to continue to get worse, right? So there's a progressive onset of symptoms. There's going to be altered sensation, muscle weakness, and then gait disturbances. If you don't get treatment over a long period of time, those effects could end up being permanent. So even with the therapies that we're going to talk about, the effects may not be fully reversible or may not be reversible at all. So we want to detect it as soon as possible to start definitive therapy before some of those changes become permanent. So patients that are presenting with neurological abnormalities associated with chronic use of nitrous oxide without an obvious cause should be asked whether or not they're using nitrous oxide. So patients presenting with sensory deficits, motor deficits, ataxia, urinary retention, erectile dysfunction, or they're discussing things like confusion or a new personality change, which is common for preteens and teens, but taking the extra step, if this was the cause, the treatment paradigm would be different than if it was not. Patients presenting with hematologic abnormalities consistent with vitamin B12 deficiency should have nitrous oxide considered as a potential cause for their symptoms. So taking a complete blood count and then doing a blood film to be able to look at some of those cells. If it shows macrocytic anemia or macrocytosis, even if it's not low enough to be considered anemia, but it's on the lower end of normal, or there's some evidence of bone marrow suppression, could lead you toward a nitrous oxide abuse diagnosis. If total B12 and active B12 concentrations are low or undetectable, and methylmalonic concentrations are raised, that could support this diagnosis. If homocysteine concentrations are elevated, that also supports it. An MRI of the brain or the spine may demonstrate neuronal degradation, which can support it. And then nerve conduction studies to see how fast the stimuli end up being detected could demonstrate impaired signal transmission as a way to be able to get a determination of functional myelin sheath ability. So now, what are the treatments for nitrous oxide abuse? Remember that when you send away the blood to test the MMA and the homocysteine, it's going to take some time for those to come back. If you highly suspect nitrous oxide abuse, you should be treating anyway in the interim. When do you not have the ability to treat as an outpatient, but rather admit them to the hospital? If the patient is unable to walk independently or has evidence of hematologic or psychiatric sequelae, right? So more than just numbness and tingling in the limbs could lead you to a hospital admission. So administer 1 milligram of cyanocobalamin intramuscularly daily for 2 weeks, and then weekly for 4 weeks, and then monthly until the person has achieved maximal recovery. And remember, their maximal recovery may not be going completely back to normal. Administering 1 gram of methionine orally 3 times a day for 2 weeks, along with that cyanocobalamin, is recommended. And one of the reasons that it's being recommended is that if you're just going with the cyanocobalamin or this intramuscular active vitamin B12, you're going to have to correct the deficiencies and then wait for the vitamin B12 to start moving that homocysteine to turn it into methionine. So there's going to be a lag for the onset of those effects. So going in and giving the methionine along with giving the cyanocobalamin should give you a faster resolution of some of the symptoms that you're seeing. If you had bone marrow suppression, something other than just a mild macrocytic anemia, you want to consult with a hematology service. So here are some important notes. So I did show you that in that mechanism that there's some impact on the formation of tetrahydrofolate in that folic acid pathway. So some of the guidance had recommended acutely giving folic acid, right? So one of the four specifically said, hey, you could give folic acid. The other two didn't say anything about it. The last one specifically recommended against it. And the reason they recommended against it is that they were saying that when you give folic acid and you put it into the system and it moves up to the stage where it's going to be turned into tetrahydrofolate, that it stresses the deficient levels of vitamin B12, making it less likely to be able to turn homocysteine into methionine, which is really what you need to do more acutely, right? And so if you have higher folic acid concentrations along with lower levels of vitamin B12, there is evidence not in the nitrous oxide literature base, but in people who have severe deficiencies in vitamin B12 that the neurological adverse effects were worse with high folic acid concentrations along with low vitamin B12 than when the vitamin B12 concentrations were low and folic acid concentrations were normal or were slightly lower than normal. So there's no direct evidence to suggest additional benefits when you give folic acid, and there's this theoretical or pharmacologic potential for harm. So it seems like it's best to not routinely give folic acid along with the methionine and vitamin B12. Some users have tried to supplement themselves if they're going to be using nitrous oxide and giving themselves oral vitamin B12 supplementation. There's no way to know how effective it may be, but there are still numerous cases of people who come in with severe issues, and they have been trying to do this vitamin B12 replenishment on their own. So there's something in that pathway that's not quite working as well as they would have liked, right? So it's hard to know whether there's any beneficial effects, if it's delaying anything, making anything less severe than it would before. But the recommendation would be to not chronically abuse nitrous oxide, not to try to give vitamin B12 orally as a way to try to get around it. There wasn't information on specific treatments to try to get people to resist the urge to use nitrous oxide once they leave. And so one thing that they may be able to consider is a ketamine addiction protocol, since they share that dissociative pharmacologic effect that some nitrous oxide people and some ketamine people who have those addictions would be going toward. What are the public health restrictions that you may be able to put in place that could reduce preteens and teens from trying or using chronically nitrous oxide products? Well, restricting sales to those 18 and older, and then requiring a valid identification to be shown, having posted details about the legal ramifications of underage buying and selling, so the people that are selling them will know that there are stakes that are associated with that, could be important. Restricting the maximum quantity of cartridges that can be purchased at a time could decrease the magnitude of the depletion of vitamin B12. Restricting sales of nitric oxide products overnight, prohibiting sales of crackers. So crackers are these things that you can buy online that you can put those little cartridges into that would open them up and start the release of the gas into the balloons, right? So when you're putting them into cappuccino machines or other frothing devices, those devices are opening it for you. These cracker devices are more linked to people that are trying to use it recreationally. preventing nitrous oxide products from being visible or accessible to the public in those retail stores like gas stations and smoke shops and convenience stores, prohibiting the sale of nitrous oxide by bars and clubs. So you can use nitrous oxide if you need to froth something for a drink, but not selling it by the balloon or other air container to be inhaled. Not a, prohibiting the sales in shops that are selling alcohol, tobacco products, or electronic cigarettes. Requiring warning labels on nitrous oxide products, and then providing public education about the risks of recreational nitrous oxide use, including ways to reduce that risk. All of these things are endorsed by this group down below, and then I give you the reference to go and see the European guidance for public health restrictions. So in addition to that, I added a couple of my own, and that would be additional public health measures such as banning the use of brightly colored packaging, cartridges, canisters, or tanks, banning any mascots, and then banning names that suggest partying or being high, and then finally banning candy or fruit scents or flavorings could all be effective. What public health information do they think that a effective campaign could go through? So this is the same European group, and these are all of their guidances. Explain why inhaling from a balloon rather than a cartridge, cylinder, or tank reduces the risk of frostbite. Provide information on why releasing nitrous oxide into an enclosed space, such as a car, a plastic bag over your head, or via a face mask, has a higher risk of asphyxiation. Why people need to seek urgent medical care if frostbite has occurred. Why can an open and well-ventilated area reduce the risk of asphyxiation? Why sitting in a safe environment before inhaling the gas could prevent injuries from falls? Why should users not drive a car, a bike scooter, or a skateboard while they're intoxicated with any substance, but including nitrous oxide? And there have been some car accidents where people were using nitrous oxide while they were driving, which sounds crazy, but true. Why frequent and heavy chronic use is so dangerous, and the many adverse effects that can occur if you start moving from very rare occasions to frequent and heavy chronic use. And finally, what to do in an emergency or if people are in need of addiction services. So now for the conclusions. Nitrous oxide is abused by about 2 million people yearly, and about 13 million people in the United States over their lifetime have used nitrous oxide. The use is increasing, especially in the teen and preteen population. What's being sold in gas stations and smoke shops and convenience stores is geared toward teens and young adults. And the usage figures is showing that marketing is working. The current laws against selling nitrous oxide are woefully inadequate. A simple loophole of selling it as if it were a legitimate product for legitimate purposes puts it into this quasi-legal gray market, and there are ways to try to close that loophole and make it more difficult for people to either have very high utilization or people to have more chronic utilization of the product. Hypoxic injury can occur acutely and can be irreversible. So we talked about these long-term neurological effects, but if you have a bag over your head or you're releasing it in your car, you could die today on your very first use of nitrous oxide. Chronic use can induce vitamin B12 derangement that cascades a whole host of negative neurological effects and megaloblastic anemia through things like homocysteine excess, methionine deficiency, and may also be occurring with folic acid deficiency, but you would want to verify that you had a deficiency in folic acid before you would supplement, something you wouldn't do routinely. Demyelination of nerves and these spinal cord issues can become permanent. So rapid identification, discontinuation of nitrous oxide use, and then replenishment of methionine and replenishment of vitamin B12 as soon as possible is key. And that is all I had for you today. So I'm happy to take any questions that you may have.
Thank you so much. Yeah, lots of info there. I hope this is informative for folks. If anybody has any questions, please feel free to go ahead and drop those in the chat, or we are in a meeting format, so folks can raise your digital hand to be able to unmute. If I know sometimes uh, asking aloud is easier than typing our questions in, so please feel free to do that. And I am going to also drop our link to today's survey in the chat while folks are thinking about questions. Yeah, a few comments in the chat. Jessica noted it looks like it can be easily purchased online, along with the crackers. Doing a little research on the ground as we go in the webinar, and from Christy at live music shows, nitrous balloon. They've noted nitrous balloon usage, so some firsthand experiences of folks
Yeah, and
identifying.
the first time that happened was in the 1960s and early 1970s, where people would get a hold of one of these tanks, and then they would bring it to one of these concerts, and then they would just sell the balloons, and so that has continued to this day, right? It was very unwieldy to bring the giant tank, right? But they got a lot of utilization at that party. What was really different now is that as a young person, you could go in today and you could buy something, and you don't have to put down a deposit. You can put them in your pocket and no one would know that you had them, right? And it's really hard to detect the use inside of your house. So as long as you had cash, right, you could do a completely unknown to your parents, right? You go down in the basement, smells like bubble gum or a bomb pop, right? Your natural sensation, would be to be like, oh, that smells good. Not, what are you doing down here, right? Where if you smelled cannabis, you smell tobacco, you would go down a different detection pathway.
Mhm, absolutely. And just a clarifying question from Salvador, is when folks talk about huffing, is that typically nitrous oxide or different
So
substances or a broader behavior?
yeah, no, it's a broader behavior of a whole host of different inhalants, which could include it, but it could include a lot of other things. So I've the craziest one that I've heard is where people are taking uh, bug killing spray, right? And they're putting it on a hot plate or something else that is that's very hot, and then burning it off, and then they're snorting the dust that is created, and they're calling it wasping, right? So people are doing some crazy things, but not a lot of people are doing wasping, right? At this point, there are a lot of teens and preteens that are using nitrous oxide.
Yeah, and I was thinking I'm coming from a public health background, like many of our folks here today, I know, and I was the recommendations on kind of public health and regulatory steps felt there's a lot of familiarity there. We've done this with other substances and other products before, so that was a little note to myself of kind of adding, um, that we can be mindful of talking about nitrous oxide when we're doing our policy advocacy and looking at local and state and national regulations. So I'm sure that was felt familiar to other people on this call as well, and some nice clarity in the types of steps that we might pursue to kind of try to work on closing that gray area of legality.
Yeah, and it's tough because you don't want to have a barista not be able to froth your stuff. There are alternatives to nitrous oxide that work equally as well using other nitrogen based canisters. But they're more expensive and there's not as many people that are making them. But I think there are common sense things that we can do that could reduce the risk without making it overly burdensome for somebody to be able to fix your car or make your cappuccino.
Absolutely. And we'll wrap up here. One last question from Salvador, and this may be maybe outside your area of expertise, but do you have a sense of kind of motivations for, um, especially for teens using nitrous oxide?
So
Uh, yeah.
I so when there was the Tide Pod challenge, right? There were people that were taking Tide Pods and actually putting them in their mouths, right? Just because it was a Tide Pod challenge. If you go onto TikTok, if you're a teen or a preteen, and you go on as if you're a parent, if you go on as a parent, you're never going to see nitrous oxide abuse videos put into your feed. But if you're a preteen or a teen, there are influencers and other people that are specifically talking about their experiences or they're showing videos about their experiences, and it seems really fun. Kind of like the fun that people were having in the 1800s when they went around with the traveling show with nitrous oxide originally, before they knew that there was any legitimate medical purposes for the product. And because the onset is very quick and the offset is very quick, right? And the um, how could Skittles be bad for you, right? People know what that is, and they have a sense of what it is. And so with the way that the products are being named and the flavors that they have, just like with different vaping devices, seem to undercut people's ability to correctly interpret the risk that they may have when they're using those products. So those are the factors that I think are really starting to drive that utilization in ways that it didn't before. They're not only showing that type of experience, but the influencers and the other people are actually saying, well, you could just go and get this right at a gas station, and the people are like, oh, well, there's something I could buy without an age restriction that would give me these effects.
Mhm. Yeah, the kind of a confluence of access and availability and some social influence.
Yeah.
One last question. Do you think there's any data on people who have had nitrous oxide as part of a medical procedure? It's sometimes used during childbirth or dental procedures. Going on to use nitrous oxide recreationally. I know you mentioned clinicians working around those having access and availability, but
Yeah.
any data that you know of clinical exposure leading to recreational use?
So it seems like it's relatively rare. And it's been used since like the 1860s up to today. So it's not one of the main causes of use. But I do think that people that um, are using it, right? Is it a substance of abuse? People will argue whether or not it is or it isn't. Just like, is ketamine a substance of abuse? People will say that it's not because it doesn't meet all of these different criteria. But Matthew Perry was using it, right? And then he used higher and higher doses of it. And he certainly was dependent on it in a way that ended up costing him his life. And so, with nitrous oxide, the general trend is that when people are using um, on a more frequent basis, the trend is to use more and more, and then to use it more and more frequently. So I do think that at a certain point it takes over and has features of what we would consider as part of addiction.
Great. Well, thank you so much. I know we're at our time. I do see some other comments in the chat. Jessica shared that some states have laws relating to other inhalants that might be a starting point to work on some regulatory work in this area. So, just a reminder for folks, I will send out certificates within 1 to 2 weeks. Of today's presentation, so you'll get those directly in your email. And thank you all for joining us this afternoon or morning, depending on your time zone. And thank you again, Dr. White. This was really informative and very interesting.
Thank you.
Have a good afternoon.